dial here is for temperature. So there's 3 snowflakes on the bottom, 1 snowflake on the top. More snowflakes colder, so they can adjust their temperature there. And then time, there's a plus and a minus. That's gonna go from 15 to 20 minutes. And then there's a play button at the bottom. So as soon as you hit play, it turns it on. The wraps are pretty straightforward. They'll come unassembled. So there is a kind of a bladder that's reusable, and then a single patient use pillowcase that goes around it. And that's a Velcro wrap. So, very big. It will fit any patient. And that's what we'll expand with compression and water.
So that'll wrap all around, like, looks like 3 times.
The bladder.
Well, yeah, it's Velcro, so it really, we'll just kind of wrap like this. Yeah. Yeah, this side is the Velcro.
Fits me.
Yeah.
Okay.
Is it one size fits all?
For the knee, yeah.
Okay.
There is an articulated knee wrap, but we haven't had, just so they can bend their knee, we haven't had them prescribe, any of the providers prescribe that before.
Okay. Would you explain the prescription and how the patient would know what the setting should be?
Yeah, so Dr. Rana's office or Dr. McGrory is also prescribing some. Will send us a prescription. We contact the patient, go through everything from pricing to shipping, etc. Then someone from patient care from GameReady will call them. They should be doing more of an in-service there. It sounds like, based on our previous conversation, that they need to do a better job with that. So we'll talk to them about that. And then they'll get the unit shipped to them the day before their surgery. They get it for between 2 and 3 weeks, and all the instructions then should come with the unit. That prescription, as far as low, medium, high pressure, should be in the prescription that Dr. Rana is writing, which would be in the meds tab of that book.
As well as like the time to use it, would that be in there too?
Yeah, I think they recommend about 4 times a day.
15 minutes though?
20.
20 minutes.
Okay.
Yeah, I haven't looked at one of the prescriptions in a while, so I'd have to double check there.
And as Mike said, it comes with a pre-programmed all settings, and a lot of it has to do with acuity of healing. I have yet to see a script come across with a provider indicating that they wanted a preset mode on there, so which is helpful. That's a less confusing point of discussion with the patients.
So do patients buy these, or do they?
They're rentals.
They're rentals.
Yeah, and so unfortunately, the only insurance that we get full coverage is work comp. So work comp patients, we usually get them for every 6 to 8 weeks. The cash pay rentals we do start at 2 weeks. There is a little grace period to send it back. They get 7 days, so that's one thing that we will tell patients, that they can keep it for about 20 days or so, and as long as they're time stamped when FedEx or UPS picks up the device, then they won't get charged any extra.
Okay, so are the patients encouraged to try it before surgery? Because often they'll get home and they're like, oh, this leaks or that. I said, well, do you know how to use it? Did you try it before? Well, no. Well, it would be nice to try it before, so then if there's an issue, you can contact the company and get it rectified.
Sure. We can add that. I don't think that's a conversation that happens.
From time to time, depending on when we get the script and the timing wise of the surgery, like sometimes we'll get a script and the surgery is 2 days. There's no problem. We'll take care of that. If I'm the patient, I would like to have the unit delivered to me first, get used to it, figure it out. So that's why there are any questions, we can troubleshoot it. But yeah, we do add that into the scripting when we first make contact. I think there's just a lot going on sometimes with patients, and they just kind of, but I can certainly circle back to them and just make sure that's an point of emphasis for them.
Because they're like, I need to take it out of the box.
Yeah.
Are there any other questions you guys received from patients? Because Anthony's role is to kind of not only handle those questions for you, but to point you in the direction of GameReady. So
Does everything come attached for them? Like I see the hose, is the hose plugged into the machine and the hose into the sleeve?
No, it's going to come in a carrying case like this. Everything's kind of
Everything's separate?
separate, yeah.
Okay.
It looks fairly straightforward though.
That's another.
Things are only going to
Sounds
fit
like
in one
it's pretty
spot.
easy.
I mean,
Yeah.
they're different sizes and
We can get you guys the
Is
that
that-
website with the videos because I would
That's
just refer
flat.
everyone to that
Okay,
website.
yeah,
That's the
yeah, they
best
could
thing
even
to do.
watch it here, I guess, on their cell phone or whatever. we could
Yeah.
tell them.
Yeah.
I think it was just hard trying to answer any question because we
Yeah,
had
we've
never
seen
seen
it.
it.
Now that
You know,
we've seen
so
it,
now
it's
that we've
pretty
seen
easy,
it, it's
yeah.
like, okay.
We're gonna leave this setup guide. This is the quick
See,
setup guide.
and feel free to
Okay.
defer it to us and
Yeah.
Game Ready too.
Yeah,
Um,
All the
Everything's
numbers that we should refer them to are in there.
I'm gonna leave my
That'll
contact.
be
Okay.
Yeah, absolutely.
on that shelf.
And right now, it's just Rhonda and,
We were-